I'm Dr. Mike DiTolla, and I'd like to take a minute to share with you my favorite way to remove interproximal overhangs, and that is with the subgingival strip system from ContacEZ. Is there any worse feeling than when finishing a Class 2 composite, for example, you sit back and you marvel at your occlusal anatomy and how well you made the filling disappear into the tooth, only to see the bite wing at the prophy appointment 6 months later and find an overhang at the gingival margin? I'll often look at the x-ray and I'll think, I wonder what dentist left that overhang. And then I look back at the chart and it turns out it was me. Ouch. Or maybe it's a 10-year amalgam that's still functioning fine, but it's got a huge amalgam overhang on the mesial margin that just happens to be 3 millimeters subgingival. Either way, the subgingival strip system is the simplest way to do everything from removing a large protruding overhang to reshaping a smaller overhang that doesn't protrude from the tooth. And since all of the strips in the subgingival strip system are the narrow strips, they can be used to clean out subgingival cement after cementation if it's stuck below the contact area. So when I say narrow, I'm referring to the vertical dimension of the strip itself. So it's actually shorter in that vertical dimension, which allows you to work in the subgingival space without affecting the contact area. So let's go ahead and take a closer look at the subgingival strip system. So these are the 3 strips in the subgingival strip system, and you can see they're all narrow strips. And when I say narrow, again, I mean in terms of vertical height. So you can see they're shorter, if you will, or we call it narrower than if you look at, for example, one of the regular strips. And that's because these are all designed to go subgingival and do work beneath the contact. And so we don't want to go too deep and we don't really want to affect the contact. We're looking to get rid of basically overhangs here. And maybe changing the contour. But for big overhangs, we're using this blue narrow strip, and this is double serrated. So it's actually serrated here. It's also serrated on the top, so you can get under a restoration and pull up while you're sawing through and saw up in that direction, or you can saw down or do both on as well. So it cuts on the way up or the way down. And this was cutting off excess if you have like excess composite, excess amalgam, something like that. So this is for a big kind of protruding overhang that we need to cut through. It'll also work for like resin cement if you have some of it like protruding out of, say, the gingival box on like an inlay or an onlay. You'd be able to cut it off with this one as well. So that's actually the cutter. The trimmer is this gold narrow strip one, and this is non-serrated. So this assumes that we don't have the large overhang, or if we did, we already cut it off with this. And now we're going in just to do some reshaping. And one of the interesting things about the gold strip, it's single-sided, again with a coarse to medium diamond, but it's got this area, this central gateway where it doesn't have any abrasive material here. And that just allows you to slip through the contact a little easier and then use the sides of it once you get subgingival down on whatever material you're trying to reshape. And then we have this copper narrow strip, and it's single-sided with a fine diamond, and this is how we're going to polish the restoration. And so it's kind of cut, trim, polish basically when you look at these. And so for the large protruding overhangs, we're going to start with the blue strip and then work our way down. And if it's not a protruding overhang, if it just needs to be reshaped, then we can go right to the trim with the gold strip and skip the blue cutting strip. But we've got a composite that is in this tooth, and it's got a nice overhang on it. I just put it in real quickly, intentionally with an overhang. That's how most of my composites are anyway, so it wasn't too difficult for me to try to do that. So we're going to use our blue narrow strip, the cutting one. And again, this has no diamond on either side, so we're not affecting the contact. All we want to do is to be able to get here and do some cutting. And again, we can do it on the bottom of the strip or the top of the strip since both sides are serrated. So we work our way through. And of course, we don't have real subgingiva here because we don't have real gingiva. But as I'm cutting here, I begin to cut my way through, and then I'm putting some distal pressure on this tube because, again, I want this, because of the flexibility of the metal portion of the strip, I want to adapt it around that mesial surface. And then the handle can even be rotated buccolingually as well as we work through and cut through that composite. Unlike on real gingiva, I don't think I'm going to be able to get far enough subgingival to cut with that upper portion. This material actually is more difficult to cut than human tissue, as you're probably aware. So I'm working my way using mainly that bottom portion of the cutting going back and forth. And it gets tighter whenever I turn it. If I just leave it straight in here and go back and forth, I can cut through it, but I can actually feel a portion over on the lingual, not so much on the buccal, that feels pretty good, but I can feel myself cutting through a little more on the lingual as we go back and forth. So it's a matter of going through there. If it was an amalgam, you could shoot a bite wing through there and see how it looks. If it's a composite, you can check again with your Explorer. Ooh, that's feeling better. Just a little bit more. And remember, I'll still be able to do some shaping with my gold strip once I get through there. But here it's more of a vertical motion, trying to cut down. Picture an overhang, a little donut of material at the gingival margin that I'm trying to cut through. And once that is done, again, I can take my gold narrow strip and take the area that's not coated and wiggle that through the contact, and then be able to use the sides of that strip to kind of reshape that composite. So I've cut through that protrusion, and now I'm trying to reshape that so I have a better emergence profile along there. And again, you want to use this strip. We're going to go all the way to the end of it like you see me using there, since that central portion doesn't have any abrasive on it. So we're definitely using this strip out towards the ends, whereas we usually have a tendency to use them more towards the middle. That's kind of the sweet spot. We're definitely getting the handles a lot closer to the tooth themselves as we go in there. And you can feel it as it smooths off. You'll be able to feel that in a tactile sense, you'll be able to feel that, okay, I've got my shape now, and as I come around here, it doesn't feel as lumpy as it did before. And then lastly, we're going to take our copper narrow strip, and this is the one that's got the fine diamond on the single side, so you make sure that you're not using the shiny side. You always want to have the side with the abrasive towards the material that you're using, and go in and start initially with your buccal lingual movements, and then you can tilt the head of it back towards the distal or move the handles back towards the distal and roll it just a little bit depending on how wide your proximal box is. If you have a narrow proximal box, you can just go straight back and forth. If the cavity prep was a little bit wider, you can take this and kind of go around the corner with it as well. I was in Dr. Kim's office yesterday and watched him using these strips to put bevels on direct composites, and it's kind of his all-purpose abrasive for being able to go in and either polish or trim or shape things. And it kind of opened my eyes that, oh, there's a lot of different ways you can use these strips once you have them interproximally. He was actually using them on the incisal edges of some maxillary anterior composites that he was doing. So once we've gone in there and polished it, we can go in again with the Explorer and verify that we've been able to remove that ledge that was there. I used to do this in the old days, trying to use a rotary system or a reciprocal system, and I always felt very nervous about going subgingival and cutting underneath it. I have so much more control doing it this way with the hand strips, and it might take a little bit longer to get the final result depending on how big the overhang is, but you know that you're going to be safe and you're not going to cut the patient's lips, and it's, to me, a much more controlled and easier way to accomplish the same goal. So when it comes to the safety and effectiveness of removing subgingival overhangs, I don't know of a better way to do it than with the subgingival strip system, and I recommend you always have one in your office for all of your overhang needs. So on behalf of myself and everyone here at ContacEZ, I want to thank you for your time and your commitment to quality dentistry.